Further advice and recommendations on the application of DD water. 1. Increasing the dose. From the point of view of treatment, it is decisive how susceptible the tumor is to deuterium depletion and how quickly it can adapt to the decreasing D concentration. Observations gained during the last years enable us to provide certain essential facts concerning this field. Supposing we were to grade various tumor types, melanoma seems to be the quickest to adapt. With melanoma patients having a growing number of metastases, there is no time for changing the initial dose after 3 to 4 weeks only. We, therefore, recommend to increase the dose at the beginning of every 1 to 1.5 weeks, or to decrease the concentration of DD water given to the patient gradually. This may happen to be sufficient, since we have 25 parts per million DD water at our disposal. It has not been possible to test this, so we cannot tell whether with melanoma patients by increasing the dose in the above way it is sufficient to stop progression. It is also important that treatment should begin with DD water of a concentration below 85 ppm. Cancer of the pancreas also belongs to the resistant category. This is the only type of tumor where, in a few cases only, we did not experience any positive change when applying DD water of a 90 to 95 parts per million concentration. With cancer of the prostate, we have experienced that the tumorous cell population gets heterogeneous rather quickly, and bone metastases also appear relatively soon. Thus, in tumor of this type, we recommend a dose higher than usual and a more frequent increase, especially if the volume of bone metastases is considerable. The opposite of this could be observed with, for example, cancer of the root of the tongue. Patients reacted very well with a given dose, and the effect could be maintained for years, and the patient continued to remain in remission. When the signs of progression appeared again, the tumor again reacted to the increased dose, and a repeated regression occurred. With 2 patients, this was observable even after 4 to 5 years, suggesting that the genetic variability of such tumor is minimal. The cells less sensitive to deuterium depletion do not get selected in the course of years. In general, it can be recommended that the deconcentration of DD water should be decreased by 10 to 15 parts per million every 1 to 2 months. 2. Long-term positive effect of deuterium depletion. On the basis of the long-term follow-up of patients, it can be stated that neither acute nor chronic side effects occurred during treatment. We have made 2 interesting observations with respect to the tumor. The statement below seems to contradict the above, but in fact we would like to record it. In some cases, it happened that after 3 to 4 years, the patients interrupted the consumption of DD water despite the fact that the tumor had still been present in their bodies. These cases proved that if deconcentration was kept low enough for a considerable amount of time in the patient's body, or resistance or months was maintained even if in the meantime deconcentration again increased to the normal level. This observation at the same time is in accordance with an earlier experience, namely, that DD water may be effective even if the amount of deuterium does no longer decrease in the body, but remains at a low level or a longer time. In this case, we think that tumor cells, which had not been destroyed, adapted to the low deconcentration, and although they do not necrotize, low deconcentration nevertheless inhibits uncontrolled cell division. After some years, the slow increase of deconcentration supposedly induces stress similar to what the decrease of deconcentration did at the beginning of the treatment. We have to stress that the above could not be observed if the patient had stopped the treatment after consumption for some months only. 3. The application of strongly deuterium-depleted water, 25 to 50 parts per million, is not advised at the beginning of the treatment. Because of misunderstanding of prescriptions, 2 patients began to drink undiluted 25 parts per million DD water. In these cases, we experience an inflammatory reaction within the whole tumor. But despite this, no significant tumor regression happened during the period of 1 month. Based on the above, we suggest that the D concentration applied should not be lower than the level needed to gain the desired effect, as later, during treatment, it is possible to further decrease the D content. 4. How long should DD water be consumed? The main aspect is that the treatment should have no risks, but with several patients, a progression occurred within 2 to 3 months with the untimely cessation of the treatment. If the patient is considered as cured from a medical point of view, it is advisable to continue the cure for a minimal 1 to 2 years, as this means no risk whatever. One of our main tasks in the near future is to define, through appropriate experiments, the post-treatment strategy by which the patient can, with great certainty, be called cured. 5. When increasing the dose, prostration and fatigue may reappear. If the treatment is continued with water of a lower D content, phenomena experienced at the beginning of the treatment, that is hypersomnia and fatigue, may reappear. This, however, should be considered as a positive sign, as it means that the further decrease of D concentration induces a renewed reaction, causing the further regression of the tumor. 6. Pre-treatment with DD water. As mentioned before, and stressed here again, after considering the individual case, and if medical viewpoints do not contraindicate, a DD water treatment for 6-8 weeks prior to surgery is suggested. Such pre-treatment of the patient may, to a great extent, contribute to the success of the operation. As a consequence of the treatment, it is not only the size of the tumor that may change, but its shape may also become similar to that of a benign tumor. In our view, this may be of particular significance in the case of brain surgery where the size of the part removed is critical. 7. Daily dosage of DD water. It is important that the patient should cover the bulk 75 to 80% of his daily fluid need by DD water. Our experience is show that it is favorable to consume the daily dose divided into portions throughout the day at equal intervals, rather than to drink it all at a specific time of the day. We also recommend that the patient drink 0.5 to 1 dl of undiluted DD water of a low D content after consuming food of a normal D content. 8. Pain relief. It is a known fact that in case of tumorous diseases, pain relief and a better quality of life are serious challenges. A significant pain relief may accompany the consumption of DD water, which, in the first place, is due to the positive changes in the basic condition. It is important to note, however, that at the beginning of the treatment with DD water, the measure of pain may vary significantly. This transitory period may, in some cases, last for 2 to 3 months. 9. The diet of the patient. The long-term follow-up of several hundred cases enabled us to draw some conclusions on the correlation between consuming DD water and the eating habits of the patients. Our most important conclusion is that a strict vegetarian diet will decrease or totally suppress the effect of DD water. Neither the Gerson diet nor other kinds of drinking protocol can be suggested during DD water treatment. Our general suggestion is that the patient should eat normally, like a healthy person. We therefore suggest a well-balanced diet, free from extremes. We suggest the exclusion of pork and beef, but it is advisable to eat poultry, fish, and ample portions of vegetables and fruit. Concerning eating exotic fruits, we have to mention that the deuterium content of these is much higher than that of fruits cultivated in our climate. This is why we suggest that the patient eat smaller amounts of these kinds of fruit, because they may reduce the efficacy of the treatment. We thus suggest the consumption of fruit and vegetables grown in Europe. 10. Other additional therapies. Besides conventional treatment and the consumption of DD water, several patients have tried other, alternative treatments to increase the chance of healing. The effect of these alternative treatments seemed evident in certain cases, influencing either positively or negatively the effect of DD water. but in some cases we could only suppose some mutual effects. We have collected our opinion in two groups. Issues impairing the effect: Gerson diet, strict vegetarian diet, cure of drinking fluids, consumption of coenzyme Q, hot sitting baths, depressed state, issues improving the effect, well-balanced mixed diet, cold bath 1 minute sitting in the tub of cold-hot alternating shower, local cooling of the tumor, positive way of thinking, strengthening of the immune system. We do not wish to take a stand on methods or procedures applied by the patient. According to our general opinion, methods with an effect of blocking the cell cycle at a given point may make tumor cells resistant to DD water, as the cell is not able to enter into the phase sensitive to deuterium depletion. 11. A break in the treatment. It has happened that because of technical reasons, carelessness or change of mind, the patient stopped drinking DD water for a shorter or longer period. In such cases, the signs of progression soon became evident. It can generally be stated that the process is reversible if the effect of the treatment had already appeared. The treatment that continued after a break will also have results. According to our experiences, though, it is more difficult to ensure the effect if the treatment was stopped and started again several times. In our opinion, one of the most important rules of applying DD water is that the cure must not be stopped.